Imagine two different patients. One is pacing the room, speaking rapidly but avoiding eye contact. The other is sitting perfectly still, entirely nonverbal, and covering their ears to block out ambient noise. Observing these two individuals side by side presents a serious clinical challenge. Their observable behaviors share zero overlap, yet both of these profiles map to the exact same medical diagnosis: autism spectrum disorder. To understand how two vastly different presentations fit under one label, we have to look at the manual used by the medical community, the DSM-5. The manual solves this paradox by throwing out the idea of a rigid, uniform checklist of symptoms for every patient. Instead, the diagnosis relies on a clinical matrix. To be diagnosed with autism, a patient's unique traits have to perfectly construct two foundational pillars and then pass through three strict contextual filters. Let's look at this matrix, starting with Pillar 1, Criterion A. This isolates persistent deficits in social communication. A patient must show deficits in social-emotional reciprocity, nonverbal communicative behaviors, and developing or understanding relationships. The rule for Pillar 1 is absolute. A patient must exhibit all three of these deficits. If even a single piece is missing, the pillar is incomplete. But completing this first pillar alone does not trigger an autism diagnosis. If someone has these social communication deficits but lacks the second pillar, doctors divert them to a separate condition called social pragmatic communication disorder. This brings us to the second pillar, Criterion B. This pillar is constructed from 4 traits: repetitive motor movements, insistence on sameness, fixated interests, and unusual sensory input. A patient only needs to exhibit at least 2 of these 4 behaviors to activate Pillar 2. This intersection, a strict set of communication requirements paired with a flexible menu of repetitive behaviors, is why varied symptom expressions map to the same clinical framework. Even with both pillars standing, the clinical diagnosis must pass 3 strict contextual filters. Filter 1 is chronological. Filter 2 requires clinically significant impairment in current environments. Finally, Filter 3 ensures the disturbances are not better explained by an overarching intellectual disability. These filters ensure the diagnosis is reserved for individuals whose neurodevelopmental profile has shaped how they navigate daily life since their earliest years. The precision of this matrix allowed for a major consolidation in the field. When the DSM-5 replaced the DSM-4, older, separate diagnoses like Asperger's disorder and PDD-NOS were absorbed entirely into this single umbrella. The autism spectrum operates as a rigorously structured clinical pattern. Utilizing this component matrix allows the medical community to look at the vast variety of human neurodivergence and find a reliable way to identify, diagnose, and support autistic individuals.